Okay.
Good day, podcast community. We have a special guest in our podcast today. And I want to say we've been working on Scott for quite a while. And so our people got with his people and we were able to put something together. So, Scott, thank you so much for being on. Tell our viewers who you are, what you do, and who you serve.
Yes, sir. Thank you, Pete. Appreciate that. I work for a company called First Care Management, and we are mobile primary care providers. We are internal medicine and geriatric family practice.
Mhm.
We bill insurance. We're in network with most insurances, Medicare, Medicaid, Medicare Advantage. We see all of our clients in the comfort of their home, either in person or telehealth. We do not have a brick and mortar clinic.
Mhm.
We are known for keeping our patients out of the hospital, and that is because we have mobile partners that do laboratory, x ray, sonogram, EKG, wound care, psychiatry, cognitive impairment therapy, and we're always adding new providers to our partners so that we can partner with elders and those who are living with disability to age in place in their home of choice at optimal levels of health.
Mhm.
We partner with adult children so that they don't have to take off work to take their mom to the doctor. And then we partner with facilities like hospitals and rehabs and home healths because their reimbursement is very closely tied to how many people with a certain diagnosis were readmitted to the hospital for the same thing within 30 days.
Mhm.
So we keep people out of the hospital. And it's interesting because most folks will go see the ologist, the specialist that is treating that which landed them in the hospital.
Mhm.
And they fail to go see their primary care. Well, the cardiologist just looks at the heart, nephrologist, the kidney, the surgeon, the wound, but they're not doing head to toe assessment, looking at all the meds you were on before the medical event, all the ones you're on now, and adjudicating all of that. And because we see you in your home, there's a lot of power in seeing someone actually operating in their space.
Yeah.
For example,
What would you say? Let me just jump in here just a second. I didn't realize before, a couple years ago, the lack of people that have a primary
right,
diagnosis.
right,
So tell our viewers, kind of share that, like,
sure,
I think we all assume everybody's got a primary, but would you
right.
share with our viewers what that looks like out there?
Sure. So your primary care provider generally is internal medicine family practice.
Mhm.
All primary care providers are what Medicare calls PICO certified. That
Mhm.
means they can sign home health orders for a home health for a care plan. They
Mhm.
can sign, they can order prescriptions, they can order durable medical equipment, whereas a lot of the specialists just don't do that. There's a few cardiologists out there that are PICO certified because they kind of assume the role of primary care for their, but in general, overall, specialists aren't certified by Medicare to order those things.
Mhm.
So, in addition to basically, it's the primary care that keeps you out of the hospital. In
Right.
a football analogy, the primary care is the quarterback. All
Mhm.
the specialists are the rest of the linemen in the backfield and that sort of thing. But the quarterback knows what everyone else is putting on board
Yeah.
and can say, that new medication that your urologist gave you is contraindicative of what we've got you on. So let us change our med to, accommodate that one, or we need to talk to your urologist and make them aware that you've got these other meds on board. And
Yeah,
that,
it's funny when you say that. I mean, the healthcare has gotten complicated, and when you put your desire to get that primary care in front of the patients, in front of your clients, where did the mobile part? Because I was always fascinated when you would say mobile, because we've gotten to a place where is what do you call, the waiting rooms of healthcare is like over. I mean, it's busy. So
Well, and now no one wants to sit in a waiting room full of sick people.
yeah, yeah,
Many elders and those living with disability have to find a ride because your insurance doesn't typically, unless you're on Medicaid, your insurance doesn't pay for transportation to medical appointments. And so, here's the other value that we see.
hmm
If we're your primary care provider, we put you under what's called chronic care management. And under
hmm
chronic care management, you get a touch point once a month, whether you need it or not. Now, it may be a phone call to say, okay, how you set on your medications? Do you need any refills? Is
hmm
there anything new or emergent that we need to come look at? Well, this is where an elder will tell us about the rash on her back that she wouldn't tell to her daughter because her daughter would have to take off work and take her to the doctor. So she
yes,
doesn't want to convenient, and we get on it before it ever becomes a wound.
hmm
And then testing for our lab partners. Last year alone, 165 times we kept our patients out of the emergency room just for urinary tract infection.
wow.
We send the order to the lab. They show up the next day and collect the sample. We know how to bill for PCR testing, so we get the results the next day, get the antibiotics on board. They never go septic. They don't wind up in the hospital.
Do you? My mom's 94 and she's up in Richmond, and my one of my sisters is a nurse, so she's always having to get her to the appointments and all, and she has had urinary tract infection several times. Do you, with your company, do you have reach in the Southeast, or what kind
We're
of reach
just
are
okay.
you?
So we're for face to face in the home. We basically cover all of Metro Atlanta.
Okay.
For telehealth anywhere in the state. So there are a lot of individuals who maybe live with paraplegia or quadriplegia and they're on Medicaid waiver services where they're getting nursing home level of care in their home, co-paid up to, you could have a copay as low as zero by the state through Medicaid to have a home care provider come in and provide you with those services. Every year you have to have an annual physician evaluation called a DMA-6.
Mhm,
And we do those for tons of people all over the state that are in Valdosta, Savannah, what have you. The issue is that while insurance will allow us to do a cross line telehealth,
mhm.
our orders aren't good anywhere but Georgia. So where that comes in is mom and dad live in Michigan, the daughter's here in Atlanta.
Yeah,
They want to move mom and dad here, but she can't get them to the doctor up there. If she can just get the TB test done up there, then we'll handle the rest.
gotcha. I mean, it looks like from my vantage point, you've taken a need of primary care doctor and the mobile aspect of it and put it together, which are two like magical things. How did how did you get involved, and what was your journey like?
Sure. So initially, I share the First Care Management shares a building with several other businesses. Originally, I was recruited to market a software that allows HIPAA securely for doctors to sign things, orders, prescriptions, what have you. And I started doing that, but then one of the one of the entities in the building is an adult day health.
Mhm,
And they realized, and many of them are on Medicaid, and they realized that every time these adults had a doctor's appointment, the adult day health missed their per diem payment and the elders miss their 2 hot meals every day because
Mhm.
they get both breakfast and lunch. And so they put a clinic in the building attached to the adult day health so that when they had a primary care, they could just walk around the corner and go see the primary care and not miss a day of adult day.
Mhm.
I had read so much about the future of medicine and elder medicine, and the fact that it was going mobile, that people like, if house calls could come back and be paid for, it
Yeah.
was going to be the wave of the future. Now, you got to realize this is pre pandemic, but the name of the clinic was First Care Management. And so I spoke with the owners and said, why don't we try this? Let's hire some nurse practitioners, some coordinators, some doctors, and see how it goes. Well, the serendipity or whatever, the pandemic hit and every single person was homebound.
Mhm.
Because originally that was the only way you could see a patient was if they were certified as homebound.
Okay.
And then it just opened up to everything. Well, it was recognized by the insurance providers and certainly by the hospitals and the rehabs and the home healths that
Mhm.
we keep people out of the hospital. And so basically, once the pandemic ended, all of our payer sources said, keep doing whatever you're doing because you're keeping people out of the hospital. So we have grown very rapidly. Today, I have 24 nurse practitioners,
Mhm.
24 coordinators, 2 doctors.
Wow.
And we are known that nothing mildews. In other words, for example, the assisted living paperwork that's required to move into an assisted living. Well, we
Mhm.
do 20 of those a week. And we know, and when you get them, they're filled out right, because the doctor who doesn't do them very often might check a box that says needs continuous care. Well, you've just prevented that person from being eligible for a personal care home or an assisted living. You just basically said they need skilled nursing home only. And so
Mhm.
just little things like that that we've learned over time. And
Yep.
then we work very closely with hospices. They get a referral. They haven't seen a primary care in 6 years. They need an order in order to even evaluate them for hospice.
Mhm.
So same day, we'll jump on telehealth with the family. The insurances say as long as we lay eyes on them, that's an appointment, that's a face to face, and
Mhm.
then send that hospice that order to evaluate and if appropriate treat. They get their equipment in that day, and that person gets that wonderful benefit of hospice. Whereas if they had to wait 2 weeks to see their primary care, they might not be with us any longer. The
Yeah.
other way is they evaluate a patient and they do not yet qualify for hospice. They'll send them to us for treatment and they're tagged with the hospice. They get them back when they're eligible.
Mhm.
Or, as you and I both know, hospice is not the coffin nail everybody thinks it is.
Yeah.
People graduate off of hospice.
Yep.
And when they do, they need treatment. So the hospices send us those patients and then we treat them. Um, I do get a lot of patients that come out of like LTACs, long term. They come home with trachs and vents and peg tubes and all sorts of stuff. Well, they need a doctor that follows them. And remember, your health insurance doesn't pay for transportation. So, $1,000 ambulance rides can be very expensive and add up.
Oh, yeah.
So we go in the home and see them and then see, is there anything else that we can order that insurance will pay for that'll help them to age in place, help their caregivers provide the care they need. And we're even a provider for the state of Georgia's Money Follows the Person program. And this is where people are in nursing homes but want to come back out in the community. And so we'll pick them up as their primary care and make sure they have all the medical needs covered. And then the families are trained by home health to do
Mhm.
the tasks, plus they also get Medicaid waiver, in home care, either nursing or whatever, depending on the task. And so we fill that gap very well. Um,
Mhm.
all in all, I've identified about 10 different types of referral sources, and we teach our coordinators when you see a referral, look at the referral source, and that should tell you immediately what the critical success factor is and why they referred us. And so that's what you need to get done and get it done quickly.
Yeah, that's I took a ride from Wellstar to Shepherd after my stroke, and I didn't realize that the ambulance service from the home to the hospital was covered
It's
under
covered, right?
insurance, but $2,500, that was the most expensive Uber ride I've ever had. It was not covered. I was like, okay, you got to pick it up, and it's like $2,500 to go 20 miles. So,
and when I see you next at that networking group, I'll
yeah,
give you a couple of names. They're a lot cheaper than your run of the mill ambulances, but they do ambulance services. They
do
just
they really? Yeah,
they
it's
don't
good
do
to
medical,
know
but it
because
is private pay.
yeah, and it's knowledge
You
is
there?
so important to apply it, because when you don't know and you make those decisions, of course it can come back to cost you a lot. What do
Well,
you
and
what
I
is your
have,
biggest
go ahead.
challenge? Because you're managing growth, you're
Right.
managing a great concept, both two great concepts in a healthcare industry that's discombobulated, to say the least.
Well,
Which
we have the most siloed delivery of healthcare anywhere in the world,
Mhm,
and the silos don't like to talk to each other. And that's where having a primary care provider comes in, and there's your quarterback. We
mhm,
also find that it's so funny when people are interviewing us to see if they want to use our services. They're like, "Well, which hospitals do you have privileges at?" Well, all of them. We can admit a patient to any hospital because once you go in, your doctor doesn't follow you anymore. It's a
yeah,
hospitalist. And
yeah,
then the doctor takes the baton when you come out. So we fill that role, but you don't have to have privileges there in order to send a prescription to that pharmacy plan or to
mhm,
order durable medical equipment or to refer you to specialists who aren't mobile in that healthcare system.
mhm,
So, just education is a huge part of what we do.
yeah,
I have this philosophy that in any other country, an elder is viewed as a repository of knowledge from a life well lived.
mhm,
And it is there for the gleaning if you but spend the time to talk to them.
yeah,
Here, turn on the TV. It tells you need a facelift, tummy tuck, weight loss, because you need to look young.
yeah,
Therefore, we all focus on looking young. We all deny we're aging, and we don't shop this space until there's a crisis.
yes,
And many times, for example, when I owned 3 home cares, people would hear what we did, and I knew it was coming. And here it comes. They're going to say, "Now Medicare pays for that, right?" Well, no, health insurance doesn't pay for custodial care. It's long-term care insurance or something like the VA aid and attendance. Okay, well, how do I get my mom some long-term care insurance? Well, 15 years ago, when she was healthy, she
yeah,
would have been a candidate, but now it would be, if you could find somebody to write it, it would be entirely cost prohibitive.
yeah,
So just little things like that, and knowing how what's required. And that's how we get so many referrals, is because our home care partners, we know their license rules and regulations. Our
mhm,
home health partners, we know their license rules and regulations. Assisted living, very different. If you go to the hospital and come home back to your assisted living, and a hospitalist who does not know assisted living law has written you a handwritten note, Tylenol as needed for pain, it's worthless to the assisted living. So we go see that patient and turn it into an order that says Tylenol every 4 hours for left shoulder pain as needed.
mhm,
Now they can pass that med. If the state walks in, they're going to pass with flying colors. But knowing what people, how they need it, and being able to do it quickly, that just bodes well for us as far as referrals.
mhm.
And we admit right now, we're admitting anywhere between 35 and 45 patients a day.
Wow.
Yeah.
What do you I mean, I've always, when I heard your presentation at ASCNN, I was amazed at the 2 coming together, and it just seemed like too good to be true to have two great concepts merged together. Where do you see, like, you're in Georgia, you're servicing Atlanta. Do you plan all to expand beyond that? Is there other companies that in other areas of the country that have recognized this opportunity?
There are a few. There are competitors here in Georgia, but they only want to go into a facility and see 20 patients. They
Mhm,
don't want to go into a single family dwelling. And we have figured out how to make it work utilizing nurse practitioners as feet on the street.
mhm,
But even though nurse practitioners are allowed to write in Georgia, our doctors insist on reading every chart themselves.
mhm.
So they review the chart, they overlay their medical expertise, and then all of that goes back to the coordinators who then order the pharmaceuticals, the lab tests, the durable medical equipment, the referral to a nephrologist, so on and so forth.
Mhm.
And that's where the care management part of our name comes in
Yeah.
that while we don't do full case management, if you need a referral in your zip code in network with your insurance, we help you find one
Hmm. Hey, that's,
rather than just say go see an ologist.
yeah. Giving people the solution is so powerful because we're so used to in the last maybe 10 years of just being left hanging,
Right.
trying to figure things out. What how are you guys handling technology? Because it's moving very fast,
It is moving.
trying to keep
Just
up.
in just in the past week,
Mhm.
I have seen two demonstrations of AI.
Yep.
One where it just plugs in the wall and it learns the habits and movements of the person, and due to millions of data points, has predictive skills of possible falls or
Yep.
urinary tract infection
Yep.
or what have you. A lot of the home care companies are putting this in to the homes for families that maybe need 8 hours of care but can only afford 4,
Yeah.
so that there is an extra set of eyes kind of
Mhm.
watching. And then I saw one this week that is a analysis of a cough. And I never realized that coughs are as unique as your eyes or your fingerprints for each
Mhm.
individual.
Hmm. Wow.
And you establish baselines and cough 10 times.
Yep.
And every morning when you get up, you cough 10 times. And this thing just keeps the baselines. And so the actual guy who was presenting it just went to a trade show in Vegas, and he
Mhm.
came home, and the next morning he coughed 10 times and his baseline had dropped 40%. And he was asymptomatic, but did a COVID test. And guess what? He was positive.
Wow.
I mean, just amazing.
Yeah.
And then from this, I was on the board with Tech Sage down at Georgia Tech, and
Mhm.
that is they are working off their third $5 million NIDER grant, so National Institute of Disability Research. We had
Okay.
all these white papers on aging, all these white papers on disability, very little in the literature about I live with disability, blindness, deafness,
Yeah.
MS, what have you. And now I'm aging. What do you have for me? Well, these brainiacs have developed a robotic bed that will turn you to keep you from getting bed sores.
Ooh.
They have a robot that will shave you that was actually tested and fine tuned by a person living with quadriplegia that
Uh,
could not shave himself. Because even though you can do it, what's the right pressure to put that razor?
yep.
This sort of thing.
Yep.
It's just amazing. And then every kind of app you can imagine for your phone.
Yeah.
So
Yeah.
whether you're
It's
visually impaired,
moving very
and so
fast.
we're open to it and we're very interested in it. It's just that we want to see what's it cost,
Yeah.
what is the benefit to our patients? How is this going to help our patients
Yeah.
be at optimal levels of health? Here's an example. It's not technology, but we partnered with a group where each year, as we do our annual wellness visits, to be a candidate to be reviewed by this other group, You need to have multiple comorbidities, so be diagnosed with multiple issues,
Mhm.
and a possible victim of polypharmacy, where too many cooks in the kitchen. And we'll send that chart over to them. It is a pharmacist and a forensic pathologist, and
Mm.
they take the hour and a half that our pet doctors don't have time to do, drill down into that chart, and then come back with something about, okay, you guys had these three drugs as a cocktail. It was working great until this ologist threw in this, and now you need to change those three meds because it's not effective. It's pretty cool.
Yeah. It's I'm excited about it. My partner, he's up in Canada, and the last 6 months, he's really been digging deep into how AI is affecting productivity, and so he implements into smaller companies ways to save 10 hours a week of
Right.
time. And when you think of the advancements that are coming, they are exciting because healthcare, just like you described, to be able to take all these pharmacy drugs that we don't have any idea how the body reacts to it. But when you can analyze it and be able to give somebody a report to say, hey, this drug is not going to work with this one,
Right.
your patients are going to be so much better off.
Well, and they have genetic testing now too, that if
Yeah,
you meet the criteria, you send in a cheek swab and they come back and show you 500 drugs that whether your genetic predisposition to metabolize that medication.
right.
So let's say your doctor wants to put you on something that's $1,000 a month out of pocket, and you've got a report that says you're only 25% likely to even metabolize it. Well, let's not waste your money.
Yeah. Yeah, exactly. When you're focused on the patient and you can make sure the results get to the patient quickly, and then you can react and be able to adjust, because everybody's different, but it's how you are able to assimilate that information in a timely fashion to be able to make the person as healthy as they possibly can, or whatever adjustments they're making in their life, because we all know as we get older, all my friends are hip replacements, knee
Yeah.
replacements. I mean,
Mhm.
it's like across the board, there's being replaced all these parts, and
Mhm.
it's just the body wears down. But
It
yeah,
does.
I like the idea that you guys address the mobile and the primary care. So what do you do like when you're not, you know, taking care of the business? What do you like to do for fun out there?
I hunt and fish, and I'm a big Georgia Bulldog fan. So
Ooh,
I
you
went
got
to
a
I
big
went to
game
UGA.
coming up this weekend.
Oh my goodness, that's going to be a nail biter.
Yeah, and I heard Donald Trump is showing up too.
Oh,
So
I heard. Yeah.
so you
What's
guys
interesting is, see,
definitely have some action in that stadium.
I'm
So,
originally from Alabama, so I have a
okay.
lot of relatives that are Roll Tide,
Yeah,
and but I matriculated here in Marietta, Georgia, and went to UGA, and
okay.
so I'm a big Bulldogs fan. So I watch football, college football mostly. I do my own yard work and
Uh-huh.
do hunting and fishing and things like that. That's what's makes me happy. Gardening,
Yes.
that sort of thing.
Well, that's awesome. Now, I want you to tell our viewers, how can they get a hold of you, Scott?
Sure. You can either contact me at 833-633-4778 or go to our website. It is the number one, S is in Sam, T is in Tom. That's how we spell first. Care, CARE, management, MANAGEMENT.com, firstcaremanagement.com. There are lots of videos on there that talk about transitional care,
Mhm.
chronic care, visits, so on and so forth. But if you scroll up, once you hit the landing page, there's three tabs. The middle tab, new patient forms. Click
Mm.
on that. It's the same forms we all fill out whenever we see a new provider. What
Yeah.
are you diagnosed with? Did you ever work with asbestos? So on and so forth. And then our scheduler, his name's Nicholas. He verifies your benefits and calls you right away and gets you scheduled to be seen.
That is a simple process. I love simple. That's
Yes.
so good. So, Scott, I always ask before we leave, like, what would be the one thing you would want our viewers to take home from our time on the podcast?
That house calls are back.
Hmm.
Many of our elders that we serve, they're like, my grandfather told me about house calls, and so it is coming back. It is very effective to keep people out of the hospital. And if you're the way that we operate, we're very tied in and in tune with our patient's health, and any little deviation, we're reacting to it.
Hmm.
And the only thing is that you can lead a horse to water, you can't make them drink. The
Yes,
patients have to be compliant,
exactly.
otherwise, we're wasting our time and theirs.
Well, I want to thank you, Scott, for educating our community
Well,
about
thank you.
their options because, getting this information into the right people so they know how to, initiate the best possible care is so important. I want to thank you for taking the time to share with us today.
Well, thank you so much. I appreciate it, Pete, and I'll see you at one of those networking meetings.
I definitely, and I want to encourage our viewers, share this video with people you might know need to hear Scott's story and the messages they're bringing to the marketplace. Because the more people that know their options like this and can be treated at home and to have a primary care option, the better our health care will be. So
Absolutely.
thank you so much, Scott.
Thank you. Appreciate the time.